Heat in the heart, understanding symptoms and diagnosis, an examination of various heart-related symptoms, diagnosis, and insights into underlying emotional factors affecting health. Heat in the heart is a concept in traditional medicine that signifies an imbalance leading to various physical and emotional symptoms. It is associated with emotional disturbances, insomnia, and specific tongue presentations that reveal underlying deficiencies, reflecting the complex interplay between mental health and physical symptoms in individuals. Case study 1, 46-year-old female who presented with a range of symptoms, including palpitations, chronic insomnia, and joint pain. Western diagnosis indicates chronic polyarthritis, highlighting the interplay of physical and psychological factors contributing to her condition. She has had insomnia for 10 years, palpitations, anxiety on awakening, painful and swollen wrist and ankle joints. Western diagnosis was chronic polyarthritis. She had long-standing problems with relationships and severe mental demands at work. Tongue is reddish, which signifies heat from deficiency. The edges are pale, liver blood deficiency. Then we have red, very pointed and contracted tip, which means heart blood and yin deficiency with heat in the heart. And whitish dry coating, which signifies slight dryness in the stomach. Case study 2, 35-year-old female. This case study examines a 35-year-old female presenting with distinct symptoms, indicative of emotional and psychological challenges. The diagnosis of bipolar disorder highlights the complexity of her condition, shaped by significant familial influences. She had no desire to sleep. She has restlessness, increased drive, no appetite, strong thirst. Western diagnosis, bipolar disorder. Background to disease, family history of bipolar disorder. The tongue body is reddish and long. This is constitutional heat in the heart. The edges are pale, so this is liver blood deficiency. And the tip is red, very pointed, with dark red points. It means heart fire. Then white, thin, dry coating with rootless coating at the root. Onset of deficiency of fluids and stomach yin. Case study 3, 52-year-old female. This case study examines a 52-year-old female with notable symptoms, including twitching of facial muscles, sudden attacks of fright, and insomnia. Her Western diagnosis is compulsive neurosis, which is linked to her medical history and specific tongue characteristics indicating underlying deficiencies. Symptoms: twitching of facial muscles, sudden attacks of fright, and insomnia. Western diagnosis: compulsive neurosis. Condition: background to disease. The condition began after hysterectomy. So this indicates a potential link between major physical health changes and the development of psychological disorders such as compulsive neurosis. Let's look at the tongue. Tongue is pale red with pale edges. It's liver blood deficiency. And notice the many small cracks. This is stomach yin deficiency. The tip is red with some protrusion, so there is heat in the heart. And if you look at the root of the tongue, there is a depression. This means essence deficiency. Case study 4, 50-year-old female who presents with multiple psychological and physical symptoms. Diagnosed with agoraphobia, her symptoms reflect a complex interplay of emotional distress stemming from a difficult childhood and personal trauma. She has fear of open spaces, fear of leaving her house, headaches, hot flashes and night sweats, depression, and exhaustion. Western diagnosis is agoraphobia. Background to disease. She has had difficult childhood and unwanted divorce. Now let's look at her tongue. The tongue is red and long. This means kidney deficiency with constitutional heat in the heart. The tip is red and very pointed. This translates to heart fire. And the tongue is slightly moist. Case studies 5. 70-year-old female presenting various psychological and physiological symptoms. The patient's background and tongue description suggest underlying deficiencies and heat patterns in the heart. Symptoms: inability to open her eyes, severe frontal headaches, irritability, depression, and inability to sleep through the night. Her Western diagnosis is compulsive neurosis. Background to disease: shell shocked as a teenager in World War II. So this created lasting effects on her mental health, leading to conditions like compulsive neurosis and associated symptoms such as irritability, depression, and insomnia. Now let's look at her tongue. The tongue is red with red sides. So this is kidney yin deficiency with ascendant liver yang. And it is long. So this means constitutional heat in the heart. The tip is red and very pointed, so that's heart fire. And the coating is white and dry. This means lack of fluids in the stomach. The case studies reveal recurring symptoms such as insomnia, anxiety, and palpitations, which highlight the emotional and physical turmoil associated with heat in the heart. Tongue descriptions across case studies consistently show signs of deficiency and heat, particularly with reddish coloration and pointed tips, indicating severe internal imbalances related to heart health. Background factors such as traumatic life events, relationship difficulties, and family history of mental health issues frequently contribute to the development of heat in the heart, showcasing the interplay between emotional well-being and physical symptoms.